up to you. The only thing I'm going to say is please turn your microphones off. That's all. Unless you happen to be Jerry, if Jerry's around, or if you happen to be Poppy. And I think Poppy's popping in today at some stage, she said. So unless you are those two, please make sure your microphone is off. Really nice to see you all. Just wait for a few more minutes, see who's coming in. Reverend Tooley says hi, Kinky Smiley Kitty says hello, and Master Jim says evening, Debs and the girls. Are all the girls with you, Jim? Cinda says hello everyone, hope you're all well. I am, thank you, I'm better. The Oyster says hello. Scott says hello everyone. No, I'm here, we can start now. I like that, that's funny. Mr. B says hello everyone. Cosmic says live on the stream, I'm off to Putney Munch. That's right, just set us up and walk away. I mean, that sounds very male, I'm kidding. Cinder says I'm glad that you're feeling better, Deb. Thanks, have a nice time at the Munch, Cosmic. Hope it goes well. So I hope everyone's well as usual. Lemuria, pleased to hear you're feeling better. Hello everyone, thank you. I am better, she says, coughing, but I am better. As I said, unless you happen to be Poppy or Jerry, please make sure your microphones are off. You are the only two people who can talk. Let's go through some basics, please. Again, as always, no wanking. I know you've got great cocks, great cunts, they're wonderful. No nudity. Don't want to see your bits, don't want to share your bits. Don't make anyone else feel uncomfortable in here. We've got 3 different subjects. We're talking about things that are quite sensitive for people. We're talking about things that matter to people. So don't ruin it by saying, oh, Poppy, I'd like to get under that blanket with you. Show us your tits. Like, you know, it's just inappropriate. You might think it's appropriate when you say, you've got the most beautiful smile. Some people feel really uncomfortable with being noticed. So please don't notice them, if that makes sense. So think about what you're doing. Think about the implication of what you're doing. And we've got 3 subjects today. So the 3 subjects we're talking about, if I can even remember, are mental health issues, personality disorders, antisocial personality disorders, everything else within polyamory. So mental health and polyamory, or mental health conditions and polyamory. Then we're going to talk a little bit about contraception, different versions, different variants, effectiveness and efficacy of why, how, and what we're going to do. And then the last one is about switching. So that's a little general introduction to switching, especially better for new people probably. But one of the angles we're going to take when we talk about switching is, what if someone switches with you and you're in a relationship with them, then what do you do? So if somebody's come along and said, hey, you know, I'm your dominant, well, hey, and you're like, woohoo, or I'm your submissive, and you're like, woohoo, and they go, actually, could you just swap and can you do everything to me? So when the agreement in the relationship shifts, I guess, so we'll be covering that angle about it as well, and we'll have a look at all of those things. So I hope they're subjects that are okay to people. If we're going to talk about polyamory and mental health, are many people here polyamorous? Are many of you polyamorous? So we've got 37 people in at the moment. How many of you are poly or open in some way, shape or form? So Roy says, I am. What about other people? There's quite a few. So Kinky Smiley Kitty is poly, Namori is poly. Lots of people are poly. Oyster is poly. Blake Lee says, I'm open, my dating partner is poly. I'm a cut queen, so I'm not poly. I have been most of my life, don't get me wrong. However, I like it when my partner is with other people. So it varies. I'd say I'm ambi. I'm in the middle. It depends who I'm with and what I respond to as well. Thrall says it is too. Switcher's Vixen says I'm still exploring. Playfully Morbid says monogamous, but with poly friends and open to learning. Blakely, also both he and I deal with mental illness. Yeah. Scott, I'm not poly, but the girl I'm dating is. Roy, have been all my life too. Sweet Cherry, poly and big believer in ethical non-monogamy, which is what ENM stands for, if people don't know. Like, fuck, I knew that, otherwise I'd just failed that test, wouldn't I? I'd have gone, what's that then? Would you care to explain in your own words, Sweet Cherry? That's what I would have said. I'm useless at people's names. When I go to places like LAN, I'm terrible. So, and I forget and I really worry about it, and it makes me feel quite anxious. So I've got this system now where I just say, and I say it to everyone, even if I remember their name, and that is, could you introduce yourselves, please? Because I'm not sure what name you'd like to use, whether it's one from the scene or your real name, because I also know a lot of people's real names. And I'm like, which one? do I call her mistress so-and-so or her fuck? So now I just make other people do it for me. Makes me feel a lot better. It's a lot easier. It's a brilliant system. Use it. Name tags. We do need name tags, don't we? Hello, I'm this, call me this. God knows what we'd write on them though, that would be the only problem. Right, so what I want to talk about, if we're just going to talk about polyamory and mental health, I want to talk about the most common mental health problems that we come across, really, I think. So if you look at, so the statistics at the moment state, before COVID, that 1 in 4 people had some form of mental health issue or would have a mental health issue in their lives. 1 in 4. I mean, the recent statistics don't back that up. It's definitely now becoming 1 in 2 to 3. So that's changing. And even in my own practice, and Karis was just nodding a bit, and I'm sure Poppy would find the same, or anyone else here who is any form. Hello, Smile from Minnesota, USA, and welcome. So I am sure that anyone who's a mental health practitioner will probably turn around and say, actually, at least half of my clients don't even register with the doctor, or a third of my clients, the doctor has no idea. And when you look at that over the years with your practice, when you've seen thousands of people, when you realize at least 40, 50% don't even register with the doctor, a doctor has no idea, their family know. We just know that skews the statistics. But let's have a look at some of the statistics and have a look at what the most common mental health issues are, because this is relevant as to whether we're going to have a look at them in polyamory or anything else as well. In the UK, and the statistics are very similar to America, very similar. I think it's 44 million in America. The 2 most mixed forms of mental disorder that people suffer from, in the UK, it's around 8% of people, is mixed anxiety and depression. They're the 2 most common things that people are going to come across. We reckon that between 4 to 10% of people will suffer from depression alone, let alone other mental health illnesses, during their lifetime at some point. And they are that grading is very related to economics, education, and all those other things in life. So when people are more disadvantaged, they're more likely to suffer with their mental health. I also think the very privileged can also, I think it can often be opposite ends of the spectrum. Sometimes we expect people with a lot of money and everything brilliant for them, as we define it, means they're fine, and it's not always that way. So these stats are taken roughly from 2020, and they reckon at one stage, at that moment, while we say 1 in 4 are likely to have something, at any moment 1 in 6 definitely do have some form of common mental disorder. So when we say mental or mental health disorder, that's what we're looking at. So that's from NICE, that's those statistics. It's around anxiety and it's around depression. So how does having a mental illness or a mental health illness, or whatever you want to call it, because we all feel very delicate about what we call mental health. People have very different opinions about what you should say. Is it a disorder? Is it an illness? Is it a temporary? Is it a reaction? What is it? And everyone feels differently about it. So how does any form of mental health issue, which is probably one of my favorite words that I use, how do they affect romantic relationships? Well, if I'm arguing, and other therapists are arguing, that around half of people have some form of mental illness in their lifetime, it has to have an impact on your quality of life. It has to have an impact on your productivity, on how you feel about life, on your positivity, on how you approach life and what you do. And we also know that when you have a mental health issue, it can also impact you from a physical perspective. So there's lots of comorbidities that come with things like depression. There's lots of comorbidities that come with things like anxiety. So it can make people stay in, it can stop people going out, it can make people go out and never want to come in. It can make people not manage certain things and avoid things. So when you look at the different things that affect people's relationships, they vary. So someone with PTSD, CPTSD, for example, is going to be really impacted this week in the UK. We have a fucking shit ton of fireworks going off. I can hear them going off now, which is what made me think of it. If you've got someone who's ex-army or anything else as well, people with dogs, like my dogs are okay around this so far. Haven't seen any problems, but people, like, especially if they've been involved in something, it's majorly traumatic. So this week is awful for some people. They're going to stay inside. That's got to impact a relationship in some way, shape or form. If somebody has any form of PTSD or CPTSD, that will impact a relationship potentially. I'm not going to say always, I never do. I'm saying potentially. If you've got somebody who's really depressed, really anxious, who's agoraphobic, who has major depression or has some kind of sexual mental health issue. Let's say they've got dyspareunia, which is all about vulval pain. Let's say they've got vaginismus, which is all about a tightening of the vaginal opening, so people can't have sex because it gets really, really tiny and really tight. You can't even fit an earbud in that level. So, you know, and there's no opening up. So some people absolutely, their bodies freeze. You have erectile dysfunction. You have anorgasmia, where people aren't having orgasms and cannot. You have delayed orgasms as well. All of these things are going to impact you and how you feel. Body dysmorphia, trying to get over it. Yep. So let's all go for those as well. So I was just going through a list. You've got people who are dependent on drugs. That could be alcohol, that could be any form of drug. That's going to impact a relationship. You've got people who have eating disorders, whether they overeat, undereat, whether they've got body dysphoria, body dysmorphia. Again, if we're in a relationship, can you see what I'm saying? Every motherfucking thing is going to impact a relationship if it impacts your relationship with yourself. And that's where it starts. So if you have that with somebody, and that impacts your intimate relationship with one person, what do you imagine it's going to do if you want to have intimate relationships with 3 or 4? It's got to come into it. You're going to be dealing with different people in different ways, and we'll come on to that as well. However, we also know if you are in a communicative, effective, impactful long-term relationship, that actually it can actually make people's mental health get better. It can also make it get worse if the relationship isn't good. So that's something else to think about as well. So how does any form of this sort of mental health affect and impact an intimate relationship? Well, I mentioned a lot about sex. If you are trying to get intimate with somebody and you have sexual problems, you need somebody who understands. You need somebody who will listen. You need somebody who gets it and doesn't blame you. You also need somebody who doesn't keep saying, it's about me, isn't it? It's because you don't fancy me. That's why it's about me, isn't it? You don't like me, do you? If you like me, it would be okay, wouldn't it? And if you imagine trying to sleep with 3 or 4 different people from that perspective, it's going to have a huge impact. It could also be that people have intimacy problems because they've had surgery that's gone wrong, or they've had cancer, or they've had something really majorly wrong. It's not always just mental health. So the mental health can actually make these things worse because, oh my God, they don't like me. Someone with erectile dysfunction, it shows. It's the most obvious thing, isn't it? If somebody isn't, if somebody who owns a cock isn't turned on, if I'm not turned on, you wouldn't guess. I could argue whether I'm wet or not. I could slush in some slush, that's a new word, I'm going to go with that one. I could just slush in a little bit of like lube or something and you wouldn't necessarily know. Or like some women don't get overly wet anyway, and some women get very, very wet. You know, too wet can be a problem, dry can be a problem. However, for a man who owns a cock, fucking hell, like it shows. So immediately, if the person can feel very bad about it, when you start thinking, in this head, this one doesn't work. And as a woman, if you're sleeping with that person, or as a man, if you're sleeping with that person, as somebody who doesn't identify as either of those things is sleeping with that person, it causes an issue because your immediate reaction will be about you. Oh God, don't you fancy me? Oh, I'm sorry. Has this happened before? Oh my God, are you okay? And fuck, all that pressure, all that stress starts to come in, and we make it about us 9 times out of 10. We can feel inadequate. We can have performance anxiety. It can take 3 or 4 times for people to be able to feel okay about having some form of okayness, which impacts our capacity and our ability to bond, to form an intimate relationship, to attach. Those things come into it. So that's one of the main impacts that that's going to have. It will also have an impact where people might feel really ashamed about that, might feel really resentful, might feel really unhappy about all of those things. Jesus Christ, having a mental illness is fucking bad enough, isn't it? Trying to do it in a relationship, add in the fact that what so-and-so thinks, or your mother-in-law thinks of you, she depressed again, is she? Don't know, do you think you should find someone else? Quite difficult, isn't it? Yeah, she's not very supportive, is she? That she could be anybody, by the way. And then if you've got polyamory in that as well, that's going to make a difference. Again, come on to that one in a minute. So all of those things are really not healthy. Then we've also got, if you think about the third angle of that, it must be worse for the person with the erectile dysfunction, because that can also mean eating disorder. So I'm going to assume you mean erectile dysfunction, than the partner. Yeah, but some partners will make it utterly about them. Oh my God, it's me, isn't it? Like, I'm so sorry if I lost some weight, if I put some weight on, or if I changed my, like, do you want me to dress up in something, whatever, instead of just shut up. Are you okay? What do you need from me? Let's just stop. It's okay. I'm all right. I'm worried about you. Are you okay? Just shut the fuck up. Just for 5 minutes. It makes such a difference. We've also, as I was about to say, we've also got the other problem where people come in with this, where we turn around and we try and white knight, we try and rescue, we get on the drama triangle. Many years ago, I ended up not going out with this guy. We always have a bit of a joke. He didn't pay for half a cab. I don't mean literally half a cab, I mean a cab journey. And I was like, fucking hell. And we had a bit of a laugh about it. And I wrote a piece, and he turned around after us and he said, the problem is, Deb, you're not damaged enough. Those are his words to me. He says, as a female submissive, apparently I'm not damaged enough to be attractive to some partners who are male dominants, who just want to save me and rescue me and make it okay. What the fuck, Karis, was kind of my, wow, okay, really? And I wrote about it. It was quite, he's not a cunt. He was trying to put forward something, Cherry. So I understand where you're coming from, but I was like, no, I really disagree with that. However, there are lots of white knights of both genders. White knight does not just mean a man. Let's really get rid of that. There are lots of white knights on the scene who wish to ride in on their charger and save the partner that they're with. And that can create codependency. That can create all sorts of issues. So when you're a carer for somebody, whether you are physical or anything, Karis, that's really funny. Jerry, now by the sound of it, he lacked the warmth and depth to be a cunt. I like that. That's funny. And Playfully Morbid said, looking for damaged people to dominate reads like a red flag to me. I don't know if it's just to dominate. I think what it is to rescue, to heal, to give them a sense of purpose and value. We can create a lot of codependency in partners. It's an unhealthy relationship, because what that happens is we enable somebody's something in them by, like, if you're with an alcoholic, you buy them alcohol. If you somebody who is morbidly obese and eats and eats and eats and eats, you're supplying ice cream all the time. If somebody doesn't feel good about their lives, you just keep making it worse instead of saying, I'm not playing, let's not do this in some way, shape or form, or you make it about you, as I said. And that can get quite nasty. It can increase abusive behavior and everything else as well. It's not particularly nice. So we need to think differently. How does that impact? I think, so is there a good way to rescue? Just wondering if I'm too clingy or give too much sage advice. If you look up the winner's triangle instead of the drama triangle, that's a really good way to have a look at how we do things and how we change things. That's a really good way of doing it. So if you have a look at, so Karpman was the man who wrote about something called the drama triangle. I think I've spoken about the drama triangle before. So if you, the winner's triangle, however, was a more modern version of that. And that looks at somebody being assertive rather than a rescuer, or caring. And it also looks at somebody being vulnerable rather than the victim, persecutor, rescuer type roles that people normally have. So there are ways to do it that are better. It's okay to be assertive. It's okay to be caring. However, if you're forever stepping in, oh, thank you, Cinders. There we go. Winner's triangle. There you go, Scott. Cinders has already put it up for you. There are loads of them that you can just look up. They're really easy to look up. I don't always spend loads of time talking about things that you can look up because I think they're easily accessible for everybody. So it's the way we do it. We can care about somebody, but if we always step in, so like, here's my phone, and this is a classic, right? So if I turn around, my dad, there's a note from my dad that says, have you finished? I've told him I've got a workshop 7 till 8:30. Have I finished? Of course I haven't finished. And actually, I have to really watch this because I want to persecute. I want to jump on the triangle, go, look up, you fucking wanker. But I'm not going to. I'm going to care. I'm not going to answer it later. I'm going to say, no, if you remember, I'm going to finish at 8:30. He's 84. I can be nice. It's the way we talk to people. It's the way that we do things that really matters. We need to educate ourselves about different mental health and issues. We need to really learn about what the other person wants and needs. We need to educate ourselves and change the way we do things. And we need to look after ourselves. If you've got somebody who's in a terrible state, in some way, shape or form, you've got to be able to look after them. And that's where Polly, you've got to be able to look after yourself and them. That's where Polly can really step up and come in a very positive way. Because if somebody has a mental health issue, actually, they're going to get different things from different partners. at different times. And actually, if somebody is really, really not well, it can spread the load. However, if somebody really isn't well and they pull away, but they go and see one of their partners, one of the other partners, I'm using the word partners, it can be all sorts of things here. Just going to use it for now, so it's easy explainer. We can take it personally. So actually the key, especially in poly, if somebody has mental health issues in any way, shape or form, is do not take it personally. It isn't about you. It rarely is about you. And it's so easy to take it, like, especially when we start to look at things like sexual issues, and especially when we start to look at things like anxiety or anything else as well. Are you okay? Do you trust me? Are we all right? What should we do? And actually, anxiety, we know from some of the tests that people have done on anxious people in situations, is one of the most catching things that we feel from anybody else. It isn't anger, it isn't sadness, although lots of us can cry at the same time. Actually, what they did is they put the sweat of people having different emotions into these specialized fabric bags. They asked people to wear the bags, they put them in very hot rooms, and when the anger was seeped, a lot of people were like completely okay. They did sadness, they did happiness, they did all of them. But the one where everyone in the room started to feel a little bit strange, a little bit dodgy, was anxiety, because it is very catching. Is there someone out there? No, there isn't. Are you sure? I think I just saw someone. No, honestly, I don't think you did. What was that? Oh no, hang on, I think I might have heard that too. Here we go. And it's quite easy, rather than be able to stick to your guns of, no, we're fine, we're good, it's okay. And when you're talking about polyamory and you're talking about BDSM, let's add that in as well, it's very much about trust, isn't it? So if someone is anxious or isn't turned on, we can often go into, yeah, but do you trust me? Are we okay? And that's a really bad path to go down. That can make us feel really not well. We need to listen to the partner and say, I really want to be with John at the moment because John's really happy with this. Cool, I'm really thrilled for you. What does John do that I don't? Is there something I can learn here? Rather than the whole jealousy thing and the risking of, you know, that's great, but I haven't seen you for 2 weeks, why aren't you seeing me? We've got to think about these things and the impact of these things. We can't take them personally. Let me understand what's going on for you so I can help. Well, we haven't had penetrative sex yet. Why not? You've done it with so-and-so. Yeah, but I feel more relaxed with them. Oh, great. Really? Just think about what you're saying. Like, it might be that you're in a newer relationship and things have changed. I think as well, when you've got more extreme forms of mental health that really impact us in different ways. I was talking about EUPD last week, and I was talking about not so much about antisocial personality disorders. The EUPD is such a push me, pull me. It's so difficult to hold boundaries around. I was talking last week about, for a lot of people with EUPD, I have to hold a hell of a lot of boundaries because it's fuck off, but don't leave me. No, come here, but not that close. Just can't breathe. And I've made mistakes over the years with the UPD as well. And something I used to do was, no, you can send me a text message wherever you want. And it was really handy and it was really cool. That much communication isn't that possible. The business that I am in now, no, you can send me 4 messages a day, 5 messages a day or less, or you can send me a couple of emails. We have to really think about the implication about what we're doing and saying. And it can be the same in a relationship where, especially with EUPD, if you have something like favorite person, which I covered last week, EUPD is emotional unstable personality disorder, or lots of people call it borderline personality disorder. They changed from borderline because it sounds too much like bipolar, and they've changed it to emotionally unstable personality disorder, which is actually just a history of trauma. That's what it really is. But there's so much mistrust with that. So that one in poly can be good because people can spread the load. It can be good for that person to learn to trust lots of people. And that person needs lots of communication and confirmation about okayness because they're going to have a very anxious, deeply thought attachment pattern. So it's all about not taking things personally. So we have to look at that as well. If in poly or BDSM, you have somebody who has some kind of mental health pattern or illness or not wellness, start to say to them, listen to them. They're the expert in themselves. Listen for a while. And then after a while, you can maybe do some research, do a little bit and say, actually, I've looked up this. Don't become the doctor, don't become the therapist. Recommend that they go and see someone who's right for them. That's very different. But start to watch patterns. If there are patterns that emerge in certain things, try not to engage in the patterns. Try not to get pulled away by the patterns. And then, like, hey, let's talk about this. Can we identify what's going on here? What can we do about this? How can we help? How can I help? What is it I can do? And not to feel jealous of what somebody else does for the person or how it works. That matters too. So we've got to find that balance. And that's not easy, especially when there are multiple people involved. I think as well, there are times over the years where I have been interviewed by a dominant partner of a submissive to say, well, are you going to change them? What's going to happen or something? Why do I allow that, which is fairly unusual? Because I'm going to tell that dominant in no uncertain words that this is a three-cornered contract, that they're not going to hear what happens between that submissive and I, regardless of their gender, that this is my job to work with them, and I'm trying to help them become the version of themselves that they want to be, rather than the one that doesn't feel as well at times or isn't doing as well. And actually that they need to butt the fuck out of it in a very healthy way, or be supportive in a very healthy way. They have to make that decision. We've got to be very careful about that, because a lot of times people won't always do that. So again, have to be very careful about what that looks like and how that works. I think as well, sometimes partners just want to hide, disappear for whatever reason. And sometimes they need to be encouraged to come out, and other times they need to be allowed to do that. And if you've got 2 or 3 partners, that adds a pressure to please everybody all of the time. And if you have a mental health that's all about pleasing somebody and you're letting them down, it just really doesn't help. So we need systems of communication. In DS, we can do enforced communication sometimes. We can say this is a requirement, you've got to do this, you've got to do that. In poly, pure as in not with DS. So I'm not saying poly is pure or not, I'm saying just talking about poly versus just talking about DS. In DS, we might be able to enforce something that says you must communicate every day, I need to text every day, you've got to do this, you've got to do that. However, does that allow for their mental health wellness? That's something that needs negotiating, because only you two know. I'm a big believer in shared journals. I'm a big believer in writing. I'm a big believer of doing things online to help someone understand where you are. Unless you communicate every day, you're really good, like you text or you talk, you do WhatsApp, you do all sorts of different things. That's very different. I think you've got to have fucking realistic expectations about what this is going to look like. You cannot make somebody change. You cannot make someone's mental health better. I can't. And that's what I'm paid to do. What I can is enable somebody to educate themselves, to feel something differently, to be aware of their own mental health, to eventually then get better, one hopes, because of the sort of relationship we have as well. So you've really got to be really sure about what you're doing, and you've got to be really careful not to allow the other person or you to violate your own boundaries. When somebody is really mentally unwell, they will twist and manipulate you to change your boundaries. That's a no-no. It's really hard as a therapist. We're pulled into that all the time. You did this. Therapy does that. You did this as a partner. You do that. You did that. And we get this blame circle going on, and it's like, I'm not playing. And it's really important to do that as a couple, as a throuple, as a 5, as a 6, a sextuple. That sounds very kinky. I think we should bring that in. But those sort of things are really important. We have to think about how they work and what they do. And Shiro's One Pet Play says, like searching out a book in the internet and gifting it to a partner, enabling the partner to help him. Yes, for sure. And sometimes what you've got to be careful of with a book is I want you to read this because I think this one will work for you and I want you to listen to it. But then what you've got to remember is the person reads it with all their own filters going on. And we miss out the bits that might help us and whatever, which is why therapy often is going to be a hell of a lot better for people, because it is with somebody else. And as Jim says, this is why we have supervision as therapists. I'm looking for a new professional supervisor. I do peer supervision with 2 people at the moment on a regular basis because I have to. And I've actually just said to Poppy, should we do some more together? Because like it's really important. We really have to. Talking as a person who thinks he has a small amount of autism, says Shiro's One Pet Play. Yes, it could be. So that I think as well, we've got to be careful about self-defining, self-pathologizing. You know, the amount of kids I get in my room, honestly, who say, oh, I've got anxiety. And I say, okay, cool. When were you diagnosed? They look at me like I'm mad. No, I've never been diagnosed. Who says you've got anxiety then? Oh, my mum. Or I read it somewhere. Oh God, we've got to be really careful about pathologizing. We are all on every spectrum out there. It just depends how far it goes. TikTok told me, yes, absolutely right, Holly. Or, you know, Deb mentioned it in a workshop, and that's a fucking definite. Jesus Christ. You know, like, we've got to be really careful about these things that we do to ourselves. They're really bad for us. Like, they're not good. So please make sure that, you know, if you want a professional diagnosis, go and see somebody who can professionally diagnose you. However, that can be really difficult, and that can actually get in your way. I'm specifically thinking of one person here who, when I met her, without a doubt, EUPD, straight in my face, borderline, quite bad, actually. And her life really wasn't okay. Diagnosing her, we improved her life. It took 2 years. And then there was another year. So it took 3. The third year was about shifting in different ways. It takes a long time. And then the year after that, she went and did something really cool. So cool. Like, her and her partner ended up wanting to get married. So what they did was they took a year off together, and they went around the world. And every month where they were in the world, they bought a wedding dress and a suit from a secondhand shop and took a photograph, but never told anybody where it was that they actually got married until the end of the year. But they took a wedding and a photograph in every month and everywhere that they went. It's quite cool. She was so together by then. She was so good. And at the end, she said, "Did you ever want to diagnose me?" And I said, "Fuck, hell yeah." I said, even as a therapist, on some level, we diagnose in our heads, because the reason we diagnose is we can look at a treatment plan. That's the only reason we do it. And then we do a treatment plan kind of in retrospect. Afterwards, we're like, okay, I'm looking at this, I'm looking at that. You think we're just chatting to you. I know it feels like chat. It's very interesting. So we've got to be very careful about how much we diagnose ourselves and what we do, because we're all on a spectrum. And then you've got to watch, if you've got multiple partners who know about this stuff and start diagnosing as well, rather than one person, or they're talking, or they have an intervention, or they're talking behind your back as well. That's when poly can bring some dangers, I think, for some of us sometimes. So you can enforce communication in some way, shape or form if you want to, if you have BDSM in your lives. I think the same as with poly, it's all about communication. It's about having meetings. It's about having talks. It's not all that. It's not really boring. Don't get me wrong. However, you have to look at your boundaries, your limits, what you're willing to do, what you're willing to take, where you're willing to go, how much you're willing to do and take. If you don't do that, where do you end up? We're going to talk about this for 5 minutes. If we don't get it sorted, we'll do it again in 5 minutes. I was working with the DS couple the other day, and so it's a male-female relationship. She's fucking smart. She's a qualified psychologist, psychotherapist, American, and her partner's studying, and it's really interesting to work with them. She is a superwoman. I've written about superwoman submissives before. They're a nightmare. That's me. The superwoman submissive, absolutely awful to deal with. I would not want one as a partner. We're good at most things. We've got the answer to everything. She's got a fucking answer to everything. And they were about to do something really important. And so we put the system in place, and I said, I want you to put in the system of the 10-minute talk. And she said, what do you mean? And I said, right, so if you are saying you trust him to make decisions for you, and she was saying, I know, but, so she goes into that thing, no, but he's going to do this and he's going to do that. So no, we need to do this and we've got to do that. And so we did it in the session, and I said, okay, 10 minutes, talk about all your fears and worries, go. I mean, she only took 5. It's really interesting when we really start going. And then what she did was just repeat all of her concerns again and again and again. This is going to get broken. I'm really worried about this. What about the insurance? What about that? It was all to do with moving. And by the time the 10 minutes was up, he went, okay, I hear you. So we practiced this because I taught him how to do it. I hear that these are your major concerns. These are my answers to your concerns. We will wrap up all the art separately, because he wanted to move instead of having movers. We will wrap up all the art separately. We'll put it in our car. We'll move it, because they've got quite a few days to move. It's not just one window. Even if it's awful, I can get it done. Look what I've done. And it's all those sort of things. Oh, thank you, Nemoria. That's submissive superwoman. So that's me. Hello. Self-confessed. I feel like I've just gone into an AA meeting, but it's called a Superwoman Submissive. It's an SS meeting. Hello, that's me. I am an SS. Right, so it's, and we did a couple of systems, and actually she then took it. Oh, that was Goose. I don't know what Goose is doing. So she just squealed in the corner. Superwoman, so SSS. No, the SS. No, that's not going down well, is it? I can't do that. I'm a Jewish woman. That's an out for me. I think SS is taken. Thanks, Poppy, pointing that out. I don't know. I could re-own it, couldn't I, as a Jewish woman? I suppose. Definitely not. So we've got to think about these things. What are the boundaries? What are the limits? What am I willing to do? What am I willing to take? What are you willing to do? What are you willing to take? It's a four-way thing. It really goes all of those ways. And that's especially if somebody really has mental health issues. It's really important. You can bring it into scenes, you can make it cathartic, you can bring it into meetings as well, you know, and you've got to remember, I think the other place where people go is mental wellness isn't just about mental illness, you know, and I think that's really important. We have to look at how we look after ourselves generally. As a submissive partner, I was talking to my partner the other day, actually, and we were talking about something, and I can't remember exactly what it was, but one of the words I said, one of the things I came up with, the danger with me is, or was it even today? The danger with me is I'm less likely to complain, and I'm less likely to put myself out there to say, what about me? And that's then a danger. It's my responsibility to put myself back in the mix and say, no, I count too. What about me? So the danger with me is I'm less likely to do that as a pretty submissive woman, even for quite an eloquent, self-aware human being. I can really fall into that because, you know, gosh, you'll leave me if I'm not okay, if I'm not perfect, if I'm not the superwoman. So all this stuff comes into it as well. It's not, mental wellness is different to mental health. So I think we have to think about love, and we have to think about how we love people and what we do. Is your love unconditional? Anyone here ever done unconditional love? No. Look, do I think unconditional love matters in a way? I think it's a nice ideal. I don't think anyone's love is completely unconditional. We all have a condition that if you did something, you can't take that out on me. You can't do that. That's wrong. We have boundaries. So do we mean conditions are boundaries or different things as well? And that's even more so in poly. If you've got that person is the one I always talk to, that one is the one I always have sex with, that's the one that I always do play with, or this, then you're separating all your partnerships. They're never getting a whole person, and that's not healthy either. So how do we become whole with everybody that we're with in some way, shape or form? Even the love of my cat is not unconditional. So Ginge, I've got a cat called Ginge. He's clearly Ginger. I've got a cat called Ginge who people know about a little bit because he had £4,000 worth of surgery on his leg a few months ago. And he's really well known and famous. He's known locally as the Asda cat and all sorts of stuff, and he's lovely. But I picked him up the other day because he's really struggling with Goose. And I went upstairs into Kaylee's bedroom. We've left the door open on purpose because she's happy for the cat to be on her bed. I'm not. My door's always shut. I don't like that. And I put him down and he just fucking scratched my hand. And I went, you fucking little shit. I can't believe I spent £4,000 on you. You can go fuck yourself. That's how I felt. I don't think he understood. I don't think he even listened, to be fair. But my love was not particularly unconditional in that moment. I was like, fuck off, you cunt. I was really not happy. Anyway, so anyone got any questions about anything to do with polyamory and mental health? Or have we covered quite enough for people? What do you think? Is that enough for people for now? Have we done that in some way, shape or form? Because we're going to move on to contraception. Again, that's interesting when it comes to poly and or mental health. £4,000 on a cat. How much BDSM gear could you buy with that? If you've seen the pictures of my cupboards, it's a small proportion of that. Honestly, I've got pictures. I've got 30 plus years worth of BDSM gear. I don't need to spend £4,000 on it anymore. I've gone past that stage, so I'm quite happy to spend it on the cat. So anyway, when we start looking at sex and sex with a multitude of people, we do have to start to think about our sexual health, our sexual safety. If we, that £4,000 isn't huge for a vet's bill. They're really expensive, aren't they? They're crazy. Vets and dentists, two of the biggest expenses in your life. They're so expensive. It's crazy. Right, so we've got to think about safe sex, but what does safe sex mean? So safe sex comes into two categories for me, a few more as well, actually, but two major ones, and we're only covering one of them today. One is to stop pregnancy, and one is to stop STIs, STDs, whatever you want to call them, for your sexual health. But last time, what I was talking about was efficacy of preventing pregnancy and how to use things. And people said, let's have a little look at that. So there are different forms of contraception, different forms of birth control that people call more than anything else. The first group that you've got, because I studied psychosexual psychotherapy, and part of it is looking at this, because people say, I use a condom, it's 99 point something percent effective. And I bet it's not, because you have to use something properly to be able to do that. And by properly, it means exactly according to the criteria that they set down in the leaflet. Anyone here on some form of contraception or uses some form of contraception? I don't. I'm a fucking old woman now. It's not a risk for me unless I'm talking about STIs and STDs. So if you are, right, so if you do, it's all about efficacy. It's about how you use it and what it means. I have an IUD. Again, so there are different forms of birth control in the way that we use them, the efficacy. And so there are different methods. The first bit we're going to talk about is reversible contraception. And so let's go with an IUD. That's an intrauterine contraception. So there are different things that you can use. There is a copper T that you can use. We've got things that have, they're called all sorts of different names. You have some that have progestin on as well. They're called different things in different countries as to how you use them. Levogestrel is American. I had it in the UK. What was it called? The Mirena coil. So it's called different things. Thank you. Scott, I struggle to raise the topic of STD in a conversation. Is there a sensitive way to raise the question about contraception and STDs? Yes. My way of bringing it up is my personal health and your health really matters to me. Can we discuss our take on contraception? Can we discuss both of our takes on our sexual health and well-being, and see where we mix and see where we agree and see where we disagree? That's a really easy way of doing it. That's the way I would do it. I would really like I would really like that conversation. I'm getting some messages from a certain person. Should I mention them? I'm getting messages from like that. Look, one of the risks with IUDs is one that happened to me. It's my story. They're telling me to say it. It makes me laugh now. It didn't at the time. If you have an IUD in, never get somebody to put a whisk inside you, a balloon whisk. Because yes, I did go to a hotel room. This person did put a whisk inside me. The pieces, the strings that come down, they're not actually string caught, which they shouldn't do, actually. Boom, pulled the whisk out. It didn't. So on an IUD, they have these cords that basically you have to move them in a certain way to change the shape of T shapes. And yeah, I bled quite a lot. That's quite a horrendous story. However, there is a new, I know, I wasn't very whisk aware, as people say. Yeah, fucking hell. Let's not do dad jokes. My partner's in tonight, who'll use that one forever. Fucking terrible. Never get someone put whisk inside you who doesn't need a caveat. Honestly, now you will all ask, is there a whisk? And if you, do you know, also, if you are a larger or a fat cunt owner, you have fat inside your walls of your uterus, right? You do. I'm really sorry, but that comes into it. When you put a balloon whisk inside someone, part of the risk is as well that it will catch some of the skin and it will twist, right? Don't do that. Menstrual cups. Yes, menstrual cups can also take out. It depends, because they cause vacuum and different things, and so can having sex in water. We can cause vacuums, and actually that can also make you get stuck together. This makes my entire body cringe. You should have seen me, the blood. I honestly, what that hotel thought, I don't know. It looked like somebody had been shot. Oh God. And I'm such a proper person. I was like, oh my God, oh my God, oh my God. I need to clean the blood up. And this person isn't really helping. And I'm quite a sensible person. I'm going, yeah, but I need to get to hospital. Fuck. And whatever. Is fisting dangerous with an IUD? Yes and no. You're probably not going to pull the IUD out. However, if you are slamming and playing in some way, shape or form with a cervix, same as if you're fucking and you're quite large, you are going to have some form of impact. That person said to me, how did you leave without anyone noticing? I'm not kidding. I turned up at that hotel room with just a coat on. I had a quick shower to try and stop some of the bleeding. I shoved a load of toilet roll and I nicked one of their bloody small towels. Oh God, and walked out. Anyway, Did you hear about the right and the whisk that caused quite a stir? Oh my God, dad jokes, don't share them, honestly. Right, anyway, let's not go into that. There is also a new form of coil. I think it's called the ballerine or something as well. If you look at it, it's really interesting. It's got like it's a little curved shape. It's like circles. It's available in America. In England, you can only get it if you pay for it privately. And it's got a slightly different shape. It's not like the T-shaped one. So it's not like the other ones that we have around nowadays. It used to be that they only recommended that you had the coil if you'd already had a child, if you have a very tight cervix, because once you've had a child, your cervix is slightly open. People do sounding with cervixes and all sorts of different things. So fisting and well endowed could impact a coil if you are consistently banging and hitting. It should not do. However, the risk of having a coil badly put in can happen. You can perforate the bowel, you can perforate all sorts of things, and you will end up in hospital in a very serious condition. So seeing counsellor, I got pregnant due to fisting as it dislodged. And yeah, that's the point. So it can go in badly. You have to wait a month and make sure it's in okay. But if you consistently pound against the bottom of the cervix, this is never spoken about, you can dislodge, move or change, and it can move, and it can move inside you. So please be careful. If you are into alternative things, like if you like being fisted or you like your cervix being massaged, if the person opens up their fist inside you and opens up their hand, as Scott says, it is a risky business. Please be careful. Think about those things. Oh God, how many dad jokes are we going to do today? So please be careful. So those are intrauterine, thanks. There's intrauterine contraception. So Poppy knows a lot about this as well. And so does Sweet Cherry. So I'm sure they can help as well. You then have hormonal type things. You've got hormonal implants. You can get a thin rod that's put in under the skin. Again, these things can go wrong as well. That's one thing. They have a failure rate of 0.1%. The in-uterine devices have a failure rate of 0.8%. So I'm giving you the failure rates at the moment. If you've got something with a hormonal ring around it as well, those failure rates are around 1 to 0.4, 0.1 to 0.4%. Can I just also say as well, if you have, God, I'm really trying here, if you have a hormonal T-shape IUD in, one of the risks with it as well is that if you get bacterial vaginosis on a regular basis, you'll keep getting it because the coil, where the coil sits with the progestin inside it, the bacterial vaginosis sits inside that part of the coil sometimes, so you get repetitive BV. So you have to watch that as well, because that will make you smell, that will make you very self-aware, and that won't impact your fertility, but it will impact everything else. Some diseases are spread skin and skin, saliva, Epstein-Barr, kissing disease. We don't call it Epstein-Barr in England. How do you protect yourself from that, or do you just need to take the risk? I'm not talking so much about disease. I did that a few weeks ago, but I can come back to that one. There is no protection. It's a bit like COVID, like don't kiss. Like it really does come back down to that sort of thing. You just have to be risk aware. You have to think about it. You have to think about, what am I willing to risk? It's a risk. I just said risk, didn't I? What are you willing to risk? Fucking hell. And what are you willing to do? Yeah, and if the only option does become just don't touch. Cold sores are the same. When you look, I think it's like 70 to 80%, whatever the figures are, of people have some form of herpes simplex 1 infection. It's a lot less for herpes simplex 2, but one can cause the other. So you have to ask, you have to have conversations, you have to listen to each other. So we're talking about pregnancy much more. So implant, it normally stays in for around 3 years. And again, the rate of it not being okay is around 0.1%. You can get hormone shots and injections. Their failure rate is 0.1%. No, hang on. What did I just say? So the rod is 0.1%. If you have an injection, however, the failure rate is around 4%. So it really varies. And yeah, Sweet Cherry's just correcting me, says implants are 5 years, so they've grown. Some are also 3 years. Look at which one you're getting. That's the difference as well. And also look at the difference with what you're getting around a coil. For most people, it's around 4 to 5 years. Over COVID, they turned around and said, no, another 2 years will be fine. It is or it isn't. It's medical. It's not, this isn't like, it's really interesting, isn't it? So like, and also I was in the vets today and I was asking about, because Luna needs a shot. And they said, oh, but we're short of shots for dogs and cats at the moment. Do you know there are no vaccinations for cats and dogs? If you've got a cat or a dog, they are very short. And she said, oh, don't worry. Does she go into a kennel or anything? And I said, no. I said, but she hangs around with other dogs quite a lot. She went, well, but she has had a few, so she's kind of okay. Don't worry, we can add another 6 months on. It's funny, when it suits, you can add another 6 months on, isn't it? And I think the same goes for medical and biological stuff as well. So please have a look and look at what you do. Okay, so you've then got combined oral, so pill, so you've got combined oral, you've got estrogen and progesterone in that as well. So the thing about the pill is I'm going to come on to how you use things effectively as well. I'm trying to go as quickly as I can. The failure rate is around 7%. It's a lot higher than the ones we've already spoken about. And the reason that the failure rate is large is actually with typical use. So I'm talking about typical use failure rather than perfect use failure. With typical use failure, 7%. Why? Because people don't take it at the same time every day. They don't look at their issues if they have a stomach ache or an upset stomach, or they're ill or they're sick, and they just miss a day and don't think about it. So its efficacy deteriorates. You'll have no hormone left, and there is more of a risk of migrating. Seen a lot of this lately. I work in a hospital. Mirena hormone coil is 5 years. You'll have no hormone left. What do you mean you'll have no hormone left? What are you actually saying? And Naomi says, that's what Dirty Gertie says. And Naomi says, I know that many pharmacy expiration dates are labeled much sooner than is really true. Yes, they are. That's what I'm saying. So some can say 3, it depends, and some say 5. The Mirena coil is around 5 years. I always started bleeding at 4. So I pushed for every 4 years when I had the Mirena coil, and the doctors were fine doing that. Again, it's also personal, you know your body. So if you have the progesterone only pill, again, with that, generally the way you look at it, oh, I see the coil has, I think, do you mean there will be no hormone left in the coil after the time limit? Thanks, I get that now, I'm with you. And then that means actually then the coil just starts working by itself as a T shape, an IT type shape. As I say, but this new ballerine, I think it's called, is copper balls in this interesting little mix. It looks like a little set of planets. Has anyone seen it? It's quite a new one. It's come over from America. And as I say, it's not very used in England yet, but a lot of people are probably going to prefer it. It's a lot gentler in the system. It's less likely to migrate. It sits differently, and it hasn't got any edges or bits and pieces that can cut into people or cause other issues. So it's quite cool. So Scene Counsellor says, Poppy, my experience of working with people is that the implant causes greater libido issues other than other forms, but I've not looked at any hard evidence on this. I've known people opt for this when they want to lower their drive as well, but if you already have a low drive, you might want something else. Sorry, yeah, so, and I think you have to really ask around. You have to think, also ask around in your own family, because if your family with very similar genetics to you are impacted by something, the likelihood of you being impacted is also larger. Al says, sorry, stupid question. What does 7% mean? 7% of women get pregnant, 7% of the time you have sex, you get pregnant, 7% of cycles you get pregnant. It's the failure rate is 7%. So the likelihood of pregnancy, it's the failure rate. And it's the same for progesterone only pill. And Ayla LeBlanc says, absolutely mess with my libido. And the thing about the pill as well is, and different things. So when we talk about hormone-based drugs, they can really impact libido because people can also feel differently. And if we go back to mental health, some people who use different forms of hormones are impacted. Hormones are really important. So actually it might affect your libido. It might affect how you feel about yourself. It might make you put on weight. It might not make you put on weight. It might do lots and lots of different things to you. And it might fuck up your whole system if you want to look at some of them, honestly. You've then got the patch. The patch is one in a variety of places, depends. Please read, please have a look. Ballerine info is here if you're interested. Thank you very much. It's quite an interesting one. I was reading about it the other day. One of my clients really desperately wants it, and we were having a discussion about it. And it's interesting. So again, if you've got the patch, it's often progesterone and estrogen as well, and you have to put a new patch on a regular basis. But the failure rate for that as well is also 7%, and the same with hormonal vaginal contraceptive ring. Right, so they're the hormonal methods. Let's go on to barrier. Somebody mentioned the cap earlier, because when we were talking about the coil, potential of pulling it out. So if you've got a diaphragm or a cap, I used a cap for quite a while. as a form of contraception. I was very aware one stage that I started to get these terrible cramps when I had the cap in. I couldn't put my fingers inside myself to get it out because the amount of pain I was in. And then I went to hospital. They turned around and said that I was clearly having an ectopic pregnancy and somebody else had to get it out. It was a fucking mess. And none of that was true. But they had prepped me for surgery because they decided it was true. And I was like, fuck. And that was a very long time ago when I met my husband. Holly says, I was only looking to get one since so many people said it was seriously helping my severe periods, not really for birth control reasons. Personally, it fucking wiped my periods out completely. And I'm the sort of person, when I had periods, who could sit down and give birth to a blood clot that was as big as anything you've ever seen. And I could sit there and pour and probably fill up. Most people fill up very small amounts of blood. I had horrendous periods when it comes to the amount of blood, and it made a massive difference. It really helped me. Cinder says, rehormonal contraception, personally I steer clear of it, as caused havoc with my existing medications. So they're all things to think about. So the cup, and cups are much more ecologically friendly. So people are much more concerned about the environment nowadays as well. So people like a period cup, but they also like a cup for contraception as well, because it's better for the environment. One type of HSV cannot turn into the other. Both HSV, that's not true. I'm sorry, I don't know where that is, but that isn't biologically right. So who into news? That's not biologically right. They can live on the nerve or the same, but they can still create it. So you've really got to, I'm not saying they morph one into the other. Saying that's not true isn't technically correct either. However, what can happen, I need to be really clear about this, is you can give somebody herpes in their genital region with HSV1. Does that make sense? But not necessarily give them HSV2. So you've still got to be very careful because it lives on your nerve endings. For me, I get them around my mouth. I get them at the bottom of my nose. You can't, I'm not saying you can morph, but you can give someone herpes. So you've got to be really careful. You really do. So diaphragm, cervical cap. It's like a thimble. It's really small. You put it in before you have sex, and it's used with spermicide sometimes. And the failure rate for the use of the diaphragm is 17%. 17. That's really high. And I have looked at figures from the CDC on this. I'm not just picking on anybody. The sponge is even worse. The sponge has a spermicide and it's placed in, it fits over the cervix. You have to leave it in for quite a while. But that failure rate is 27%. That varies as well. If you've never had a baby, it's 14%. If you've had a baby before, it becomes 27%. Interesting, isn't it? Condoms. Classics, aren't they? That's what everybody uses in any way, shape or form. Everybody loves a condom. There are all sorts of different types made of different things. You can look and get all sorts of different condoms in so many ways. But the typical failure rate for pregnancy is 13%. Whereas we buy condoms and because we think they're high 90s, but with typical use, I kind of thought you always need a condom if you do not want to have kids, although I also thought maybe it reduces the intensity of the sex feelings. Is this a misconception? Depends who you ask. If you ask a lot of men, they'll tell you. So there are different types of condoms made of different types of things with different levels of thickness and thinness that can help people. The key about intensity of feelings is actually the fit. Lots of people buy a condom that doesn't fit them. Too big, too small, wrong shape, wrong size. There are new condoms. You can get condoms made out of hexagon shapes. You can do all sorts of things nowadays. And some of them have different things in, so it really makes a difference. Have I missed a question? I'm curious about Al's question above. Have I missed one, Naomi? Then if I've missed one, I'm really sorry. Read it back out to me and let me know. Some of my exes clearly didn't get the message. Everyone loves a condom, but they're the classic, aren't they? Al, if I've missed your question, I'm really sorry. Oh, the 7%, it's the likelihood of it not working. It's the pregnancy issue it's the failure rate is 7, as I said, but for condoms, it's 13%. Whereas if you read the packaging, it'll tell you it's 99 point something % safe. Now, the reason we're talking about this is because of how to use it. That's the problem. That's the real issue. Most people use them. Failure rate means the likelihood of pregnancy. That's it. Per each time you have sex. or 7 out of 100 users, it's the percentage. Yes, so there's a 7% failure rate. For condoms, it's 13%. And of course, you've got to be really careful about what you use with condoms. Lots of people mix all the wrong lubricants with them. They impact that they're broken. One of the key things as well, when you look at using a condom, when we talk about appropriate or inappropriate use, is holding it at the end of the base of the penis. So like, for example, if you fucked, people go, oh, I'm just going to pull out here, and you've got both your hands up. You've just impacted the failure rate massively. Part of the instruction says very clearly, hold at the base of the condom. So you've got to be really careful about what you use. There are also female condoms. Their typical failure rate is 21%. However, they can also prevent STDs. Please be careful, as can condoms as well. We are talking about pregnancy alone. Spermicides as well, their failure rate is 21% because people don't use them properly. So typical failure rate is the typical use that people do without following what the instructions tell you purely. That's one of the differences as well. You've got the next form of protection that you've got is fertility awareness. You know, all those apps that you can get at the moment, the different things that you can do. You look at your fertility pattern, people use them to fall pregnant and to not fall pregnant. However, the failure rate on these is fascinating. It's between 2 and 25%. It varies because it depends on which method you're using, different days and different times. Another one, to compare with 30-odd% for the sponge, how about safe periods? Well, that's the problem that's we bring. So if you put the diaphragm and foam, condom and foam together, I don't have the research on that one. I don't know if you put them together. I'm going to assume it gets better for sure because you've got two methods. But again, how effectively you use them. The rhythm method, let's not even talk about that. If you withdraw just before, their failure rate is actually still very high. We call them mothers, yeah. And can I just say, when you have pre-cum, guess what's in it? Seriously, what do you think it's made of? When you are turned on, I mean, it's called pre-cum. Glitter. It's made of unicorn farts. Never makes anyone pregnant, does it? That's why your fanny farts. Like, for God's sake, guess what it's made of? I mean, that says it all, doesn't it? But no, I'll pull out just before I come. Are you aware that you get wet? I'm sorry, any cock owners here, have you ever noticed a little glistening thing at the end of your cock when you're slightly turned on? Anyone notice that? A liquid? Anyone notice the fact that, you know, you get that crust build up in your pants if you're really turned on all day? Anyone notice that? Poppy's face has just gone, oh, but it's true, isn't it? I mean, you know, you've got that white fucking skid mark. For God's sake, it's called pre-cum because it's cum. Do we need this, Debs? I think we do. I think we do need this, clearly, because people don't want to talk about this shit. Right, so you've also got to remember some people aren't actually very fertile, you know, and that makes a difference too. One of the most classic things that's used not in Western civilization is lactation. So lactation anemoria, however you pronounce it, that makes a difference as well. So when you are breastfeeding, you are very unlikely to fall pregnant. In Western worlds, for fuck's sake, that's not true. It depends on when. It depends on when you start and everything else as well. The risk of that being really high, oh God, it's really high. You know, you've got to be really careful. So it doesn't work. However, because we eat differently, in environments where we don't eat a lot, have showers, penis owners. So, can I say cunt owners as well? And sorry, Jen, as a cunt owner and as a penis owner, you also have this thing at the back called a crack, right? All your sweat drips down it, all those other bits and pieces. Even if someone bends over in front of you, the whiff that comes up, you go, wash everywhere. Wash everywhere. I'm really sorry. If you want me to go down on you, I want you to smell like roses. I don't. That's ridiculous. But be clean. Come on, think about it. Hey, by the way, so is pre-cum the cock equivalent of vagina getting wet? Yeah, it's a preparation. It's a turn on. It's not quite the same, actually. The reason a vagina gets wet isn't just because it's turned on. We've had this conversation before. I've written a thing about I'm wet. Wow, that must mean you're turned on. I wrote about it a very long time ago. It's a very old piece. And actually, like being wet isn't necessarily an indication of how turned on you are. Being wet is a physiological reaction because you're about to have something put inside you that could damage you if you're not wet. Some people get very wet, too slippery for some people don't get slippery and wet at all. So it really varies. But it's all about excitement pre-cum, isn't it? It makes a real difference. So, contraception methods. There are also permanent methods of contraception, which are going to come into that category of they're the best, which are sterilization. So you've got tubal ligation, which is wrapping up tubes and doing different things in different ways. The failure rate of that is 0.5%. People think if you have a permanent method of birth control, that means you are going to be safe. No, it doesn't work that way. So that's a 0.5 as well. She's wet, so she must like it. Look, I really like that writing. It's one of my favorite writings. I had tubal ligation at 22 using Fushi clips, the best thing I've ever spent money on. Yes, it can be really good. However, like I read something earlier today, it was on Facebook or something where, no, it wasn't. It was on Twitter. I read something called The Female Lead. I really like it. It's a Twitter account. It does lots of things. Like I'm a feminist, I'm an egalitarianist. And this woman had put, what did she put on Twitter earlier? She went, okay, so I've just been to a doctor. I think she's late 20s, early 30s, who's told me I cannot have permanent sterilization because even though I'm a fucking lesbian living with a woman, I might change my mind later. I mean, come on. But that's one of the problems. And it's the same for vasectomy. We say it isn't in the UK, but it is. So a lot of people will turn around and say that you might want children, you'll change your mind. Ooh, will they? The failure rate for vasectomy is 0.15. So they go for another couple of weeks. But this is where that 0.15 comes in the first 12 weeks. Because what a lot of people do is your sperm count has to drop to 0 over the time. And that can take anywhere up to 3 months. But then what you do is you go, oh, I'm safe, aren't I? I'm going straight in. Oh, there's a lot of people that turn around and have an unwanted pregnancy because somebody just got sterilized. So please be careful about that as well. It grinds my gears as well, Karis. Polycitrus, that's what I've been told. And I had to leave the office when my doctor told me he wouldn't sign me off since I could change my mind. Yeah, it's an interesting position to be in. That's where I'm going with that one. A friend who's a lesbian has terrible periods and pain with it. Couldn't get her history. Oh, for God's sake. Okay, she changed her mind. Do you know what? I've completely changed my sexuality. I just feel like it. I'm going to completely change the fact that because that's what people do. For people who listen to this as a recording, that was my sarcastic look into the camera, just so you know, in case you're just listening to this. Isla LeBlanc says, I have a medical condition that puts it as a valid option, but my doctor refused because I'm too young. Oh, you sweet little thing. You don't know, do you? All right there. God, fucking hell. I have a friend who had tubal ligation, fell pregnant, had second child, had partial hysterectomy, and had third child, complete removal of women ovaries, no more kids. Oh, God. My sister's a retired midwife. She's medically retired. And one of her best friends was in her late 40s, midwife as well. And they were chatting. And she'd had some kind of, I can't remember what she'd had, that they had something. She said, God, I haven't really felt well at all for the last few months. And my periods are a bit, she went, I'm really menopausal. She was 47 and she was 20 weeks pregnant with twins. And their oldest child was 20 and they were just looking forward to their twins. She had them as well. Jesus. And you're 35. That's fucking ridiculous. That's just offensive. That's offensive. I'm sorry. Deb's sarcastic face. I'm used to it now. Cripe, says the oyster. So you've got to be very careful. So look up the sort of contraception you want. Please look at if it's efficacy. However, I'm going to say to you, if you really want to know how to take things, look it up. There are lots of things that tell you, like, for example, a condom. You know, it tells you even before you put a condom on, read the fucking wrapper. Is it in date? That's one of the first things. Don't get that condom out and go, well, I've had this for 20 years. It's my lucky little thing, just in case. It's probably not going to be very effective anymore. 20 years or something. So you need to have a look. You need to read the wrapper first of all. I'm just using this as an example. You can talk about the pill. You can talk about anything else as well. You need to be hard if you want to put a condom on effectively. It's really difficult. If you are uncircumcised, you need to pull back the foreskin, not leave the foreskin forward when you put the condom on. You need to pinch the air out the top of the condom. So you need to think about this. If you're putting this on with your mouth or your fingers or anything else as well, these are all the things that you need to be thinking of to make sure that you're okay. You then need to unroll it. And the key here is, please put your fingers on the base when you use it. If you feel it slipping, moving, or anything else as well, stop. Don't go, don't worry, it doesn't matter. I had an 18-year-old come to me quite a long time ago, and she said, what did she say? She said, I can't be pregnant because the condom are broken. I need to check for STIs, but I'm definitely not pregnant because I was on top. So that stuff that could give you an STI could also make you pregnant. Why would you think that being on top? Well, they don't swim up in the same way. And this is a really bright 18-year-old, so we've got to be really careful. Same, I'm 37 now, says Poppy, so over 35, they'll consider hysterectomy as a treatment option. I felt both old and relieved. Yeah, I really get that. Pneumonia kept in wallets, please, can be punctured. So can caps and different things as well. And you might have a partner who really wants you to be pregnant. This has been well known. A small fucking pin in it, hold it up to the light, put it in water before you put it in, see if there are any drips underneath, check it. People want you to fall pregnant sometimes. There's been many a case where you have a couple who one wants a child and one doesn't, and one is male and one is female and she doesn't, so she keeps putting this cap in, but he puts some pinpricks in it. Please be careful, check your own stuff as well. I give mine a shake to get the moths off it. Scott, I have to make jokes because I'm being educated and horrified at the same time. Welcome to my workshops. Horror. I should just call them Halloween in some way, shape or form. So there are no known methods with no user failure, right? There is no such thing. There's no such thing. There is no piece or form of contraception that has a 0 failure rate. I'm sorry, but there isn't. So you need to be really careful. And when I was talking about the 0.7, the 12s and all those bits and pieces, is what you're talking about there is perfect use. The way I've just described to put a condom on. How many people put a condom like that on? There is abstinence, yes, but I do mean whilst you're having sex. You've got to be really careful. Check, read the packaging, read the expiration date, there are no lights in it. It's got to be in a cool, dry place. It's no good having it in the sauna. Do use latex or polyurethane. Try to use water-based silicone if you can, all these different things to prevent breakage. Don't put them in a wallet, ever. Put them in a pocket separately. Don't use certain forms of spermicide. That's really important as well. Don't use baby oil. Don't use coconut oil, cooking oil. Don't use petroleum jelly, like the stuff that we use. I arrive with it on. Again, won't work. Got to be erect the whole way there. Some people put 2 condoms on because they're really worried about pregnancy. That isn't effective. In fact, it makes the efficacy worse, really does. And if you are going to do something and you're changing position massively and you find that you lose your erection slightly, take the condom off, put another one on. Seriously, honestly, that regularly, all those different things. But people don't do that because we just don't, because we think that's not the way it is. So, as I said, you've got all the different methods that you could have and think about: IUDs, contraception, hormonally based patches, rings, all the different things that you can use. And they can be really effective. As I said, if you look at something like, there's a really interesting piece on the NHS, actually, if you want to look it up, that talks about perfect use versus typical use. So for something like the vaginal ring, what they say is if you use it perfectly, according to the instructions, it's 99% effective, which means fewer than 1 in 100 women will get pregnant from using the vaginal ring if they use it perfectly. However, with typical use, it reduces to 91% effective. And then that means that 9 in 100 women will get pregnant from using the ring. And that's the problem that we've got. It's the same with a pill, with everything else as well. So male condoms will turn around and say they're 98 to 99% effective, which means 2 women will get pregnant with the use of a condom if you use it like I just said. However, typical use takes it down to around 80 to 82%, which means 18 women out of those 100 will get pregnant every fucking year. So it's all about good use. But who here thinks about really good effective use when they're about to have sex? Do any of you? We know that when people are massively turned on, their capacity to think goes out the fucking window, and they don't do it very well. Our capacity to look after ourselves. Oh, thank you very much. NHS UK conditions, contraception. Yep, that's the one. So it tells you all about how they are. And as for natural family planning, yeah, that can be great. 99 odd percent. Typical use, 76, 24 women will fall pregnant out of 100. Jesus Christ. Like, we've really got to start thinking about perfect or typical use, but we don't teach that in schools either. Who here has heard the difference between perfect or typical use often in their life? Have any of you? Or is that new to anyone? Honestly, I think it can be new to quite a few people, because we just think, oh, I just put a condom on, don't I? No, we're talking about perfect use, not typical use. And that's where people aren't taught and aren't educated, and that really bothers me and worries me. Okay, any more questions on that one? Because that's quite a big one. I want to finish off with talking about switches for a little bit. So, okay, so do you know what? Thanks, Mim. I really appreciate that, because you haven't really heard of that. So that's fucking awesome, isn't it? And that's awesome. So thank you for admitting that. Same to Fiara and same to Puppy Nick. You've hardly ever heard of it. That's mental, isn't it? Because you are sexually, I'm not assuming you're all sexually active. I'm talking about generically, people are sexually active, right? You're sexually active and you've never heard of that before. That is a worry. Because I think if you speak to people like Poppy, or you speak to people like Sweet Cherry, they go, yes, of course, because it's their job, it's their work, and they're involved in these sorts of things to a certain extent. However, you can speak to somebody who is a qualified doctor and they don't necessarily know. As a psychosexual psychotherapist, you have to be taught. You do a whole weekend on efficacy, for what it's worth. And it was a shock to me, some of it. So I appreciate it for you, Roy and Isla as well. We have to look at perfect use, not typical use. And that typical use can make a difference of around 20%. And then people talk about unwanted pregnancies. You should have wrapped it. No, not only should you have wrapped it, as people say, I don't like that phrase, but I'm talking about typical responses. You should have wrapped it with perfect use, not with typical use, because that creates pregnancies as well. So anyone who is of any age that is somehow fertile, please think about that. My sex ed, says Poppy, was put a condom on a banana. If I hadn't looked at this because of past employment, I think I'd be so very naive at school. Yeah, it's crazy, isn't it? Or a cucumber, because they've got a foreskin. I really want to find a banana with a foreskin now. I don't think it'll ever happen. But it's ridiculous, isn't it? Because just that particular use, you know, how many people would hear? Most people have a foreskin statistically, unless of course it's down to religion or tightening and different things that happen. What we've got to look at then, though, when we do look at it, is you've got to pull it back. Do people understand that? Did most of you know that? Did you know that you have to pull the foreskin back before you put the condom on? A lot of people will not do that and put it on over the top. A lot of people will stretch it and put it on because that's the easiest way to do it, but you've got to take the air out of it. It just doesn't work that way. I didn't know. Thank you, Naomi. See, isn't this awesome when people say, fuck, I didn't know. We should know this stuff. Why aren't we taught it? But we're not taught it. Okay, let's talk a little bit about switching. Why didn't either? Yeah, it's really good. One of my partners has a tight foreskin and can't pull it back. Yes, so that is something completely different. You can go and see a doctor about that if they want to. Some people don't bother. It's especially important around cleaning. It's especially important. There are so many things that you can do about that. And I don't know what it depends if it bothers the person. It depends on what they can do. It's called phimosis, and there are 2 different versions of it as well. So you have to look. So some people it's too tight, and you can do all sorts of stuff, and surgery works often for a lot of people. So that's one thing that you can look at as well. Some people, they don't care. It's fine. But it's sad that we don't know, isn't it? I think we should know. Right. So just going to grab a drink. We're going to talk about switches. Okay. So if anyone is newish to BDSM in any way, shape or form, a switch is somebody who can be either top or bottom. So often when people think of BDSM, they think of the dominant and the submissive, or the mistress, or the master and the slave, or the pet, or any of those titles as well that go around. So for people who are more new to BDSM, some people don't know that some people switch. Loads of people know that people switch as well. I don't know what the experience is in this room. It's funny, when I do a live workshop, I also always say to people, how many people have been doing this for like under a year? How many people over 5 years? That sort of thing, because you can just get a feel for the room. So being a switch is also about a shade of grey in the middle, that I want to do either or I'm both. I think there are two approaches to switching that's really important. What you've got to ask yourself is, what turns me on? That's what you've got to ask yourself if you're some kind of switch. So if you enjoy being dominant and you enjoy being submissive, if you enjoy being a top or enjoy being a bottom, and if you enjoy both, you can be both. Being a switch doesn't have to involve sex, the same as being a top or a bottom doesn't have to involve sex in any way, shape or form. It might be that my partner talks about getting his dom on, for example. So it might be that you get your dom on with a certain person and you don't with another person. You're very much a bottom with that person. It might be that you switch with one person all the time. It might be that you switch with one person in one scene, but not in another. Some people like to be in a run to say, I'm top today in this session. I don't want us to flip in the middle. Other people like it as a fight. Other people like it as a consistent dynamic of who's going to win, who's going to do that. And I'd say that's slightly more primal mixed with some switching. I agree, I switch, but it seems to confuse people at Munches, like I have to choose one role or the other. No, you don't. Absolutely don't. You do you, Scott. You be who you want to be, and you don't have to choose. You can choose in one moment to another. I mean, and that's the most important thing. A switch is somebody who fucking knows themselves. It's a bit, for me, I think we've got to be very careful. We treat switches like we used to treat bi people in my day. So when you used to say you were bi, it still happens now. Oh, can't you make your mind up? Oh, best of both worlds, can't you choose? You don't have to choose. Fucking hell. Like who you like what you like. It's the same thing for switches. Roy says, I've never switched. My mind can never be submissive. And Scott said, you've met the people I mean. Yes, no, you look. And do you know, at different times we have a different physical or a different emotional need. Do I know how to switch? Yes. Can I hurt you? Can I do all those things? Yes. Do I know all about it? Yes. Have I switched? Yes. Do I want to switch now? No. It used to be many years ago, talking about quite a long time, especially around the 30, 35 years ago, if any of you have been around for that long, what it used to be is that the person would bottom. You would learn by being a bottom, and then you would graduate into a master. I think that's quite elitist. I don't like that. Dirty Gertie, I have to bottom first before I top. I can't do it the other way around. I love being switched. So that's interesting. So what we've got to say to somebody is, oh, you're a switch. What do you mean by switch? And as Mr. Butterscotch says, one can be a bottom without being submissive, the same as one can be top without being dominant. All of these words, what we've got to say to somebody is, what do you mean by those words? That's what we've got to ask. I love labels and I hate labels. What a label tells me is roughly what you're into. It's a point. It's a starting point of a conversation. That's all. It is nothing else. So it might mean that everything or nothing means something to you. So you've got to work it out. So Jesus, it's non-gender specific. However, your switching might change with a different gender. You might turn around and say, oh, I only bottom with women. I only bottom with non-binary. I only bottom with men. I only top with whatever. It might be gender specific for some people some of the time for different reasons. I mean, Jesus Christ, pornography loves the idea of women switching. That's what it really loves. Shove a couple of bi girls in a room, in a situation. We love that fight where pornography does a lot about that. But fucking hell, your gender doesn't matter. It's got nothing to do with it. However, it might have a lot to do for you. That's the bit. It might make a difference for you. So lots of people switch in relationships. If you think about it from a sexual perspective, even in vanilla relationships, don't they? Because, oh, I'm riding, I'm doing this. Does you riding make you top? No, but it might do for somebody in their mind. I really struggle to get on top of someone. I feel like I'm in charge. It's crazy. I know my brain gets in my way sometimes, but that's what that does for me. Even if someone says, no, do this to me. And we've got to be careful, because no, then I feel like I'm switching. So you have to be careful as well. And switching can be really exciting, but it's got to be you. You need to work out who you are and what it means to you. One of the key things for me, look, DS doesn't have to be a certain way. You can believe who you are. You can be who you are. You can experiment with who you are. There's no right or wrong. You've got to work out what the fuck turns me on. As Switcher's Vixen, I think there's a clue in your name there. I switch all depending on the chemistry. Switch battles are great fun, and I do agree it's pretty primal. Yes, exactly. But it's about knowing, isn't it? You know, I don't think topping from the bottom is healthy. I think negotiating is healthy. However, what you might find is some people might do it. So you might encourage it. It might be really different. It might create a battle for you. It might be that look, some people like receiving pain, but are still a top, would never bottom or dom or master or whatever, or would never bottom, slave, or whatever. I'm just going with kind of top or bottom for now to generically cover everything. Some people would turn and say, oh no, I could never do that because that doesn't make me a master, but I like pain, I like a finger up my ass. It doesn't make you a switch. It doesn't make you anything. It means that you are this and you like a finger up your ass. That's what it means. It doesn't mean anything else. It's not rocket science, but we get lost in this so often. You've got to be really careful. We often like that play, that power game that we play with people. If you like that and you found you like both, then fucking do both. Have fun, enjoy it. It might mean that you are responsive to different people. There's a lot of talk about ambi at the moment, and ambi is that middle person. So ambiamorous. I might be poly with somebody, but I might not be with somebody else. I might want to be monogamous. You might be an ambivert, which means like I'm not an extrovert, I'm not an introvert, I'm an ambivert. It really depends on what's going at the time. And that can be the same for switching. It could be that the person does it with certain people and doesn't. It could be they do it with a certain gender and don't. It could be that they do it as a response to a situation. It could be that they've got stresses in their lives and they want to play different roles for different reasons at different times. All of the above and more are completely acceptable. The one that gets to me, which is what the person was asking, unless anyone has a different question about switching, the one that gets to me that hurts is, I think, and this is what this person was asking about, is what do you do when someone switches on you in a relationship? I don't mean you've gone in as a switch. I mean actually just flips it and says, I've had this fairly often. I started talking about it a little bit last time. I met this guy who was a YouTuber quite a few months ago. And he was like, no, I'm very dominant. I really love my dominance. I like this, I like that. And within a month of talking, we got into how I was going to cage him and be the key holder and be in charge of all his orgasms and all of that sort of stuff. And I was like, when did that switch happen? Like, how did that happen? What happened there? That's not for me. I don't want to be a key holder. If anything, I want my partner to have sex with other people. I'm a cut queen. So we've got to be very careful. We've got to work out if all of a sudden we feel a bit lost by our partner changing, that's really difficult. That's interesting. So Lady Lid says, I'm a switch and ambiamorous and an ambivert. Well, I am submissive. I'm a cut queen. I'm an emotional masochist. I am ambiamorous. I'm more likely to work with monogamy in a main relationship. However, I'm ambiamorous, but I am more of an introvert cross ambivert. Everybody thinks that when I talk, oh, you're really confident, you love crowds. I don't. I feel much more comfortable staying in and doing different things. Scott, I generally said that occasionally feel inspired to talk for an hour or a few hours. I would like to be a fun and responsible sadist, but not a domly lord or master. Polyamory may be a solution. And I think as well, you can be a lord or a master without being domly. I think it's the attitude, it's the different ways that people take things. I think what we've got to do is, this is about honesty. A lot of people meet someone, and this does happen more, I'm really sorry, but it does, with male identifying submissives than women identifying. It happens a lot more, I'm afraid, where somebody says, I'm a dom, especially if they're male, penis owners. I don't know why. I wish I knew why. I think it's a form of manipulation. I think it's confidence. I think it's a way of getting someone. A lot of people are looking for a male dominant. You might not find one. The shortage for most people is if you are a male sub, it's really difficult to get a female top. At the end of the day, they're probably the most scarce, because a lot of women who are dominants will charge or negotiate some kind of payment. There are a proportion of women looking for a female-led relationship. They're probably the smallest group, which means the male submissives who want a female top. So if we're just talking male and female, I know some people don't like the words male and female, habit, age, different things. So if you've got women, men, you've got to really be careful, because that's not going to happen very often. So what you get sometimes is the hope is that it's a huge red flag for me. So Nemoria said, in newish relationships, I'd say it was a red flag. In long-term relationships, it could be a gradual evolution. I agree. We change. We do not stay the same. But then we've got to be willing to have, like, how do we have that conversation? Can I facilitate that? What if we're not poly? What if we're not open? What do we do with that? And I don't switch, or I don't want to change. You need a really serious conversation. As a male sub, do you have any tips on getting a female dom, not a paid one? Go out and start meeting people. Go to clubs. There are so many great clubs around where you've got very female-led relationships. You've got Pedestal, you've got Munch for dominant women. You've got all sorts of different things that you can go to. Go out and meet people. Show people that you are somebody who will serve and somebody who's worth being with, because they have the choice. Is there a good way to say this isn't me when someone starts telling you to dom them when you're a submissive? Yes, you say it just like that, Holly. I would love to do this, however, it isn't me. That's good enough. This doesn't work for me. Yeah, but I can tell you. No, I'm telling you now. See, the problem is when we start using the wrong language and we start getting involved in conversations, we don't become clear. I don't want to give. It's not me. It's not for me. It doesn't work for me. Stick with the basics. Stick with something really clear. I tried pointing out before to someone by saying, actually, I like having that done to me, not willing to doing it to other people. And they called me all sorts of names about not being able to give, only receive. Nice. Number one, that's an attack from a defensive position, because they feel that they're not. There is no right or wrong way to do these things. And I get on my high horse about this if somebody has a go at me. I'd say, I think that's a you problem. That isn't a me problem. I really appreciate that you're hurting right now, and I don't think you having a go at me is any way to sort that out. And if anything, it's a red flag, and I'm quite happy to spread your name around for people to avoid if that's the way you're going to treat me. Fuck you. A munch. Yes, I'd agree with that. Okay, so pretty much hold your ground. Yes, clear, small words, precise. Doesn't work for me. No, sorry, not interested. I don't have to switch. No, there's no rule that says I have to switch. Glow state, I'm a dom and I've been approached by male doms who think they get me to switch. I agree with that side. It works both ways. But the difficult bit is when you're disappointed by somebody else, or when somebody switches on you and it changes. And oh my God, look, I think as well, male doms can be really guilty of, yeah, but you haven't met me yet, have you, babe? Cosmic and I argue about this all the time. I talk about not coming from penetration. It's a really old conversation that we've had so many times. But he has the horn of plenty that makes every single woman come. So, you know, I've never slept with him. I'm not going to sleep with him. We're not going to sleep together. You know, it's interesting though, isn't it? And I've been told by so many men that when I sleep with them, do you know, a woman's never told me that. All the women I've slept with have never said that. That's interesting, isn't it? Even with a strap on or anything, fisting, not one woman's turned around and said to me, I'll make you come from penetration. But a lot of men have said, I will make that happen. So we all get involved with our own ego with this sometimes, don't we? But I think the painful one is when somebody turns around and switches on us if we're incredibly involved. That's what's not so nice. At the beginning, it's frustrating. We've lost some time. It's not particularly pleasant. It might not be very nice, but maybe our lives aren't entangled. The hurtful one is when our lives are entangled. So the manipulation, if it's manipulative, it's more likely to come out in the first 3 to 4 months. As Nemoria says, if it's an evolution, that's when we need to look at what can we do about that as human beings, because that's way harder, because that changes our relationship. I think you have to go in honest about what works for you and what doesn't. It's really important, because people aren't going to switch for you or change. You can't change somebody else. Like this whole thing where, you know, a male sub might say, hey, you know, I'll get you to switch because you might start liking me. And do you know what? as a submissive, you've got to watch that, because the tendency is to please or want to please or make a difference. So, oh, okay, I'll do that then. I found myself even having conversations with this guy of like, well, have you bought? Do you want me to, like, do you want to send me the gift? And I was like, no, what am I doing? And I really had to go back. Like I was just saying to Holly, no, actually, I'm really sorry. This doesn't work for me. I feel like I've been shifted in my conversation towards something else. I don't switch. I am a submissive. Yeah, I got that. But you know how to switch? Yes, I do. I know how to flog. I can give you a lesson if you want. I don't want to do it. It doesn't do anything for me. I then got, Holly, well, that's selfish. Do you know what? If I don't want the argument, I'll tell you what I say to that. Yes, it is. And I'm all right with that. I don't engage. I'm not interested. It's not for me. However, I am with a switch. I want that person to have a lot of fun. So that's when the cup queening works and the polyamory works and different things works. Go and get what you want from somebody. However, if you aren't in those categories, if you don't fall into cup queening, poly, open, or any of those things, and you're not okay with it, that's when you've got a problem later on as well. If the person says, look, I've been doing this, I've been thinking about this, I've been having fantasies about this, I really want to try this. I have seen many a couple in that situation in my therapy room. And often it is that either you do it or the person's going to end up going elsewhere, or we stop them from doing what they want to do. And is that fair? Do they then get fulfilled? What will happen? And it's really sad to watch because it can destroy some relationships. I think if someone does it in the first few months, you know you've been manipulated. That's not a nice feeling. That's something completely different. And as I say, there's a lot of red flags with that. Makes a difference. Anyone got any questions about switching or being switched on from that perspective? So when that switch isn't so nice, that's the switch of the change of the relationship. Or any questions generally about switching before we disappear for next week? And has anyone got any questions they want me to cover for next week? Do you want to write to me and let me know any? What do you want covered? That was a book. What do you want covered, or what do you want talked about, so we can have a look for the next workshop? Is there anything that anybody wants covered? Let me know. If not, I shall slowly disappear. I always thought I was purely sub. Bottoms, and gradually realised I like the idea of switching more. Haven't got to try enough, so it also seems daunting to explore. It is. I think it's really important. It's important to work out. Have a go. I think it's really hard. I think we're quite full of pressure on people nowadays of, oh, you want to try that, you're not going to try it on me. Snowprincess.com says, consider speed dating for subs and doms. Yeah, that can be good as well. Steel Barrier says, how do you know you're a switch and not a sub and a service top? Because of what you get from it. A service top is, I'm going to do this for you. A switch is more going to say, I want to do this for me. I think that's the difference. It's the ownership of where you come with it. And I've got the two therapists nodding their heads there. So I've clearly said something right there in some way, shape or form. That really made me laugh. They both went, so, hey, I might be right. I might not be as well, but it just made me laugh. They were both friends. So if you are a service top, I want to do this. This will please you. This is nice. This is good for us. A switch is very much, oh no, I want to do this. I love this. This is good for me. And you'll enjoy it too. There's a slight difference in those for me. That's how I would describe the difference. Okay, so I've gone 7 minutes over. I apologise. Thank you for your answer. I am debating this in myself for a while. Yeah, it's a big question, isn't it? As a possible future subject, how to open a long-term monogamous relationship. We can do that. So monogamy, so opening up a long-term relationship. Long-term relationship, from monogamy to poly or open? Yeah, slowly, carefully, with lots of discussion. So Scott says, very much enjoyed your talk and explanations. Looking forward to next time. Thank you. Communication here. I agree with that. Communicating. Thank you all, especially Deb, for all. Thank you. Communication. Yeah, we'll go through all of that. But it's also how to communicate, isn't it? Like, it's just not that easy. Honesty, accountability, and more communication. Says Sweet Cherry. Thank you all. I have a Patreon if you want to cover me. You don't have to. I also have a coffee if you want to buy me a coffee. Again, you don't have to. They're both the Kink Shrink. You're welcome to these. They're free every week. The only thing I ask you is please advertise them or put crumbs on them and get other people to come along. And they're done weekly at the moment. So you're very welcome. And we cover whatever you want to cover. That's one question. There are 2 spaces. If you want to let me know anything that you want done, let me know. If ever I don't have questions in advance, what I'm going to do is just, what I would do is the same as I do my healthy mental practices when I'm live. And I just put the questions to ask me anything you want. It's a bit like a test. Might fail one day. I don't know the answer to that. Fuck. Oh, that's a good one. So somebody's just written another question to me. How do I re-find my love of kink if I've lost it? It's a good question, isn't it? I like that one. That's a future question, so we'll do that one next week as well. So what we've already got for next week is how do you open up a long-term monogamous relationship into open or poly, and we'll do how do you re-find your love of kink if you have lost it. So there's room for one more question. So thank you all very much for coming. Lots of love to you all. Please, when I advertise them, please help spread the word. If you're not my friend, or if you're not following me, please do. And all I ask is that you share that the workshops are happening. So I thought one for this week was starting as a pro dom. Was it? I don't remember that one. So how to be a pro dom. Did someone ask for that? Jesus, that one went straight over me. If that's wanted, I'll do it. And the other one that's come up is I'm interested in information on primal play. You can all decide which one of those do you want. Information on primal play. It was mentioned last week. I'm really sorry. So I can put it in next week and then I can do primal play for the next week as well. See, mental, not with it. I was really ill last week. However, I don't feel ill today. I'm a bit back. Don't want to mention the pro dom as a joke, I believe. Well, okay. Look, I can do primal play or I can do how to be a pro dom. You can choose, and we can always do it the next week. Yeah, I think it was a joke actually, wasn't it? She was talking about coming in December as well, wasn't she? All right, again, thank you all. Love you all. Thank you very much. Wank a wave to say goodbye. See you all later. Take care. See you next week. Bye. Bye.
an alternative market joined.